Hello, it's Dr. Shelly from HETV and Shelly's Nursing Review. Today we have a great video on when is it appropriate to call the doctor first. So this video is titled, First Nursing Action, Call the Doctor. But when is it appropriate, right? So we're gonna call you out and call the doctor at the same time, because some of y'all be calling doctors for crazy. And I've been not only an RN, but I've also been a provider, an OBGYN nurse midwife. So I can give you both sides of the coin just to help you put in perspective what makes sense when you're trying to figure out if your first nursing action is call the doctor. But then we're not done. It's not enough to know when to call the doctor as your first nursing action. You must also know how to call the doctor. So SBAR is our way of helping you understand the appropriate way to give handoff report, call the nurse practitioner or the doctor, and also when you're transferring a patient to another unit. I want you to remember that there's some technology issues that I have seen come up with this whole SBAR thing. For example, I have seen nurses chatting when they should have been paging. So we're going to cover some of that and give you real life examples. But let's get started. Now, the SBAR technique, which was originally in the United States Navy, and we adopted it to healthcare, you're gonna need your management of care packet. So many of you know that I have 8 pink packets, and they include things like the famous study guide, oh my God, the management of care, and a bunch of other stuff that I don't have time to go into. Just text me 216-410-0936 if you want some more goodies, okay? But right now, we gotta save some lives, because y'all, you know, we gotta do the damn thing. Here we go. Now, so the first nursing action, call the doctor, is appropriate with 5 conditions in terms of your NCLEX, your HETV, or your ATI. In other words, there is nothing else you could do on this test but call the doctor as your first nursing action. The issue with when calling the doctor should be the first nursing action on the NCLEX, the HETV, the ATI, is that above all, you have to remember this is a nursing exam. If you keep calling the doctor, then you just made this a doctor's exam. They want to know what you are going to do to save the patient's life. How are you going to act responsibly using clinical judgment and critical thinking to save this patient's life? That's it. Just think about that. So if you're honest, if you think about all the times you could have called the doctor on this type of test, really, you probably aren't going to call the doctor hardly at all on a nursing exam. Average is, are you listening? Are you paying attention? Average is 1 time. So what I have given you is a mnemonic. And you know I don't do a lot of mnemonics because I know you get them confused and then you really aren't learning, you're memorizing. All right, but this mnemonic I think will come in handy. This mnemonic is when to call the doctor as your first nursing action, and it is Reese's. Now some of you are Reese's Cups lovers. I know you are, but that Reese's is spelled very differently. But this, yet and the same, is pronounced Reese's. Okay, so R-E-C-C-C, Reese's. What is it? Well, the first reason why your first nursing action is call the doctor would be in the situation of a ruptured uterus. This is a pregnant woman in labor. Oftentimes, the biggest risk factor she has for a ruptured uterus is that she was a previous C-section. If she was a previous C-section, she's in labor on your test. She's at very high risk for a ruptured uterus. If her uterus ruptures, you have minutes to save mom and baby. I have, as an RN, had this happen to me. And thankfully, I was sitting at the bedside. So when I was sitting at the bedside, the patient was in labor and her contractions were going, and then boom, in the middle of a contraction, it just stopped. So contraction, contraction, going into the contraction. At the peak of the contraction, the damn thing just boom, stopped. It's as if the monitor popped off her belly, but it didn't. When I palpated her belly, it was very hard. Rigid, hard abdomen. What is that? You got it. This is blood. Yeah, so it could be her having an abruption. It could be a ruptured uterus with blood filling up the cavity. The fact that the contraction stopped signifies that something popped. So ruptured uterus. Now, I was a relatively new nurse, but I knew this wasn't normal. She did have an epidural, so it wasn't like she was in a lot of pain. And then to add to my worries, as I'm sitting there trying to figure it out in the first 60 seconds of this happening, the fetal heart rate started to drop. At that point, I already knew, oh my God, this is crazy. So I screamed for help. In that case, a scream for help is a very good thing. You don't really have time to call the doctor. And in that particular hospital, there was doctors all around. It's a teaching hospital. I can't imagine there not being any doctors, and I can't imagine that when you scream for help, you're going to get some doctors, okay? So it's still considered on your test a reason to call the doctor first, and that's because the only treatment for this patient is an emergency C-section to save both. And my mom and my baby that I saved that day were fine. The next reason to call the doctor first is epiglottitis. This is a pediatric condition that generally affects toddlers. This child is very much in a life-threatening situation. The mother or father will bring in their precious baby. This child will be in a tripod position, which in and of itself is pretty ominous. It means they're leaning forward, really forward. You cannot lay them back or cradle them or you'll kill them. You can't open their mouth and try to get a temperature or a throat culture. You will kill them. There is literally an obstruction in the back of the throat. This child may have had a sore throat before that, may have a fever. They definitely have inspiratory stridor, and they will be drooling because they can't swallow. Those are all some of the signs and symptoms that should clue you into, call the doctor, because the only cure for this is that the patient must be intubated to get their airway clear and get them some oxygen. I'm positive they are in full respiratory distress. So that's epiglottitis. We don't see it that much. It's super duper rare. And the reason we don't see it that much is because of vaccines. Which vaccine, which is on your test? The Haemophilus influenza B vaccine. HIB, H as in house, I as in Indian, B as in ball. HIB vaccine, Haemophilus influenza B. We just don't see it that much, which is why you need to be on your P's and Q's if you see it, because we are drooling, we have inspiratory stridor, we're in tripod position, we're a toddler, perhaps we're from another country where this vaccine may not be readily available. Those are all like some clues that, oh my God, this is really bad. Okay, you need to have a trach set at the bedside, a crash cart in the room. You need all of that. And you definitely need to call the doctor as your first nursing action to get this child intubated. Another reason why your first nursing action might be to call the doctor is that you may have a patient, and I just did a video on this. You may have a patient who has just had cataract surgery. Cataract surgery is one of the most common surgeries in America for anyone over 50 years old. And the video that I did shows you all of the different things that could go wrong and all the teaching and the reasons the patient should call the doctor in the actual video, because there are several things after cataract surgery that could go wrong. And one of the issues is this is such a major surgery, although it's a minor surgery, it's such a major issue for follow-up, in the sense that this patient will have literally a follow-up visit the next day after surgery. That's how serious it is. We will see you the next day following surgery. So therefore, if a patient is complaining about anything except maybe sand in the eyes and a little bit of blurred vision, so if there's any other complaints, call the doctor, because the number one complication is retinal detachment, which you know is an emergency. So that's why C for cataract surgery is one of our reasons why your first nursing action, call the doctor. The next condition where your first nursing action is called the doctor is compartment syndrome. This, as you know, is an orthopedic emergency, but you have to be careful. Your first nursing action is called the doctor as long as the compartment syndrome is with a cast. In other words, when you think about the 6 Ps, which include paresthesia, pain unrelieved with medication, paralysis, pallor, pulselessness, pressure. When you think of all those Ps, you learned the 6 Ps. Some of you so old, you learned the 5 Ps. But if all of those Ps are a concern, or at least 1 or 2 of them, because you don't want all of them, you don't want paralysis. You may have gone too far and let this go a little bit too far. You want the early signs, which is paresthesia, earliest sign of all, and then pain unrelieved with medication. If that's true for a patient in a cast, you need to, as your first nursing action, call the doctor, because you, my love, cannot fix this patient. The cure for this is to saw the cast off the patient. You can't do that. The doctor must saw the cast off the patient. And we actually say any complaint with the cast other than itching is compartment syndrome until you prove it's not. All right. Now, why is it just with the cast? Why isn't it all compartment syndrome? Well, compartment syndrome with traction or weights, right? Traction or weights. Your first nursing action is actually remove the weights, then call the doctor. The last situation or condition in which your first nursing action is call the doctor is the consent form is not signed, or worse, it's signed and the patient has no idea what are you going to do. That's crazy. So here's our deal. Your patient may or may not have any concept of what's about to happen to them. So that's one of the reasons why part of our time out is to assess for a signed consent form and to check and ascertain whether the patient knows what the hell's going on. That's part of our timeout procedure. Now, the problem is sometimes there is a consent form, but the patient has no idea what's going on. So we as nurses have this way we deal with patients about to have a procedure when we are doing our timeout procedure, which is a big safety issue. It's that universal protocol for procedures or surgeries, right? And so I can give you the best example of why this is critical. I remember as an OBGYN nurse floating to ambulatory surgery. When I floated to ambulatory surgery, there was a patient for a vag hysterectomy. And I went ahead and got this patient in the room, or I went ahead to the patient in the room and I introduced myself as her nurse. And then I said what we all say. So what are we doing for you today? Or what are you getting done today? Or what are you having done today? Something along those lines to just simply ascertain if the patient knows what's going on. Now, the consent was in the chart, and yes, it was signed. And this, because I am old, this was a while ago, okay? So we still had paper charts, so whatever. Yeah. Anyway, I walked in this room and I'm like, okay, so yeah, girlfriend, what are we doing for you today? And she says, and I quote, "Oh, well, the doctor said he's going to fix my periods." I said, yeah, that would be true, because certainly doing a hysterectomy and taking your uterus out will fix your periods. And she goes, whoa, 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 hold up. Wait a minute. Nah. He didn't say nothing about taking my uterus out. I was like, oh my God, this patient has no idea what's about to happen to her. I said to her, oh wow, okay, hold on. I went immediately to the doctor's lounge, knocked on the door and said, Dr. So-and-so, the patient in room whatever has no idea what you're doing to her. She has no idea, for example, that you're taking her uterus out. You want to come talk to her? Of course, he was mad, came out kind of fussing and yelling, and then, surprising to me, he walked up on the patient and started yelling at her. I told you what's going on, Miss So-and-so. This is a hysterectomy. I told you you ain't. She starts yelling back at him. You ain't told me nothing. You never told me you was trying to take my uterus out. I'm not about that life. If God put it there, it need to stay there. And her uterus walked out. Let that hit you in your funny bone. So consent form not signed, or the patient has no idea what you're talking about. It's real evident. You ask her, what are we doing for you? Or you ask him, what is he here for today? And the answer is so retarded and crazy that you're like, oh no, this is bad. Now, let me reiterate real quick. Nurses do not get consent forms signed. That is breaking the law. You need to be aware that that is on NCLEX. And in real life, if you're getting consent forms signed, you're breaking the law, and they don't pay you that well to do a doctor's job. So stop it. I hope I made myself clear. Now, the name of this video was First Nursing Action, Call the Doctor. I gave you 5 reasons to call the doctor, and now part 2 of this video is how to call the doctor. Okay, so I will see you soon. Deuces. Watch part 2. Hit subscribe, fool. What you doing? Don't just like pimp me out, honey. You need to subscribe. You've been on here for a while now.